Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
That gives patients, in my opinion, it gives patients a totally different thought process as far as, I'm going to the dentist told me I needed this, they told me I needed that, they told me I needed this. No, they shared with me why the things that are going on in my mouth, why they're happening. This is Dr. Bruce Baird with the Productive Dentist Podcast, and I'm pretty excited about today's topic. And the reason I'm so excited about it is because it was one of the things that changed my entire career and changed my life, actually. And it has to do with taking responsibility for failures. We talked a little bit about that in our last podcast. And, you know, the cool part is when I went and heard John Coyce years ago, he was talking about risk factors. And the risk factors, as I was listening to it, I go, wow, that makes total sense. You know, if a patient doesn't brush their teeth, they're going to get gum disease. If a patient does not wear their occlusal guard, their dentistry is going to fail. If a patient doesn't show up for their recare, they're not going to get the same results. And what I did in the first 15 years of my career is I always took it as it was my fault. You know, dentistry, it's one of those things at dental school, they tell you the mesial buccal has to be at a 90-degree angle to the exterior surface. And if it's not, it's going to fail. And you make a B. Well, a B, it must fail faster than if you make a C. It's just, you're told things have to be perfect. And now, trust me, I've used materials that were probably not well vetted early on in my career. One of the, using a new composite resin that I thought was the best because some doc told me it was, and it turned out it wasn't the best. I'm going to take responsibilities for those kind of failures. Those are easy. Those are easy to take responsibility for. The art glass crowns that I did, 500 and some out of those art glass crowns. Well, the art glass material sucked, but there were big lecturers out there in the country telling everybody, oh, this is the best thing since sliced bread. You ought to do it. Well, I redid all those, and I redid them because I knew it was a material's fault. It wasn't the patient's fault. But that's where I draw the line, because what's going to give you the freedom to practice the kind of dentistry that you really want to practice? And we talked last time about telling patients about difficulties, telling them how, a front tooth is the hardest thing in dentistry to do. But what we have to do now is we have to tell the patient that for sure, you have periodontal disease. We go through it with them. We talk to them. Does your mom and dad, did they lose their teeth? Oh yeah, they lost their teeth when they were in their 30s. Do you know if they had gum disease? I'm noticing that you have some bone loss and you have some other areas where you're losing bone around your teeth. Now that doesn't mean you're going to lose all your teeth, but you're going to have to do some things different. Genetics have kind of dealt the hand for you. And now you're going to have to do things different if you want to keep your teeth. Does that make sense? And the patients, I never had a patient say, no, that doesn't make sense. They go, sure. Yeah, that makes sense. And I said, so what we do, what I recommend, what I would do if I was in your situation, you're going to have to come in on regular basis. The average person comes in once every 6 months for a cleaning. And, the average person is going to do fine. And their teeth are going to be in their mouth for their lifetime. But you happen to be one of those that already are showing signs, whether you're 20, 30, 40, 50, you're showing signs of losing the foundation around your teeth. And that's a significant problem because that's the number one reason why teeth are taken out is because of gum disease. Does that make sense? And I said, so what we would need to do is get you in on an every 3-month basis. What we're doing is we're taking care of what we call the biofilm. It's the bacteria that get around the teeth. And these bacteria have been shown to increase the chance of heart attack, stroke. It's been associated with Alzheimer's. So we know so much more now about the bacteria, and we want to make sure we take care of that for you. Does that make sense? Yes.
Doctor, are you tired of repeating yourself with your team over and over again, and yet you still see treatment walk out the door? If so, you're not alone. The Clinical Calibration Institute, powered by Productive Dentist Academy, is an all-new online platform that unites your team around your philosophy of care, so patients can say yes with confidence and you grow with purpose. Including online curriculum with world-class faculty, monthly live mastermind sessions for each department within your practice, and an online private community, this is your home to grow. Head over to clinicalcalibration.com today to join every member of your team for one very low monthly membership fee. That's clinicalcalibration.com.
So when we start talking the periodontal realm, it's very easy now. If that patient leaves and comes in for their first 6 3-month visits and then finally don't come in again, what would you expect to happen to their gum disease? It's going to get worse. What about decay? What about erosion? What about acidity in the mouth? You see somebody that's got this issue with acidity. First thing I always ask them is, what about soft drinks? Are you a soft drink drinker? Or I'll say, do you take a lot of medications? Because you'll see these people, they walk in, they got a bottle of water with them, and they're sipping on it. I go, wow, your mouth is super dry, isn't it? Oh, gosh, yes, it's been dry. Do you take any medications? Oh, yeah, well, I take blood pressure meds, I take this med, I take that med. Well, almost every one of those cause a dry mouth. And Bob, saliva is a natural cavity protector, and you're not getting that now. So we really need to work to get you on fluoride appliances, or we're doing topical fluorides when you come in for your cleanings. Do you drink soft drinks? I go, yeah, I might have one or two Cokes a day, which that actually means 5 or 6 a day, in case you didn't know. But yeah, 1 or 2 Cokes. And I go, well, that's great, but you're going to have to quit doing that, because that's what's starting to cause this decay. You see the decay here, and you see that's what's doing it. It's soft drinks. Really? I had one patient that had been coming in every single year at Christmas. He came in, he was in his early 80s, and I saw him probably for 12, 15 years. And he would come in at Christmas. He had no cavities. He had no plaque. He just came in once a year for a cleaning. And the guy, it was amazing to look at. He had had no restorations, no crowns, no inlays, no fillings, no nothing. And then the next year he came in, and all of a sudden he goes, or my hygienist comes to me, she goes, Dr. B, you got to come see this. And I was like, oh, okay. So I go in, and there he was. And I looked at his x-rays. He had decay on 80% of his teeth. I mean, significant decay, like blowout decay. And I was like, wow, Bob, what's going on? He said, well, last year I had a heart attack after I saw you guys. I had some heart problems, and so they put me on these medications. I said, do you notice a dry mouth? He goes, yeah, I do. I get a dry mouth. I said, so what are you trying to do to help that? He goes, well, I carry water around. I drink that all the time, and I'm using a couple things I saw over the counter to help. He says, but the best thing I'm doing is, I've been sucking on these mints, these candy mints, Werther's candies. I said, man, I love those. He says, so I keep them in my pocket. He reached in his pocket, pulled out about 5 of them. And he goes, I just suck on them all day long, and it really helps with my saliva. I go, Bob, that's what's causing the decay. That's what's causing all your teeth to break down. What God gave you for 82 years was perfect. But one thing changed, and now all of a sudden we're faced with this problem. And unfortunately, he passed a few months later. But that just goes to show you there is a cause and effect in dentistry. If and when I start talking to people about their bite and how strong their jaws are, real easy to tell them. For me, it is, because I said I got tested back in the late 70s, and they noticed that my bite was 1,000 pounds per square inch. The average person, 125 pounds to 150 pounds per square inch is normal. I was at 1,000. That's why I break stuff in my mouth. Does that make sense, Bob? He goes, yeah. I said, well, I don't think you're at 1,000 pounds per square inch, but you could easily be at 5, 6, 700. And that's why when I look in your mouth, I notice this crown broken, porcelain broken off of here. There's an edge off of this tooth. There's wear on the teeth. You've got wear that is so significant, and it's because of what you're doing at nighttime when you're sound asleep. And that's what I'm going to recommend. And there's a lot of different types and a lot of different philosophies about it, but I'm going to recommend an occlusal guard for you. And what that occlusal guard is going to do, it's going to let you kind of park the car at night. So you're not grinding your teeth away during the night, or you're not clenching and building these muscles. And people say, well, I bought one of those things at at Walmart. And I said, is it soft? He goes, yeah, you can just put it in there and it's kind of like a football mouthpiece. I said, well, the problem with that, Bob, is you're going to chew that all night long. Well, what's that like? Well, that's like I'm building my bicep all night long. So you're making these muscles stronger and stronger and stronger. So we have to do something different. Does that make sense? Oh, well, yeah, that makes total sense, Doc. So, and one of the things that patients say inevitably is, this is the best exam I've ever had. I haven't even gone in and started looking tooth by tooth, but what I've done is I've made the patient realize that they have issues, they have problems. I don't have problems. In other words, it's not my problem, it's their problem. Super important for you to see this, because, the patients have to take responsibility. So I tell patients, I said, isn't it frustrating? It seems like every time you come to the dentist in your life, I look at all these different things that you've had done, and now you're coming to see me. Isn't that frustrating? They go, yeah, every time I go to the dentist, I have something new. I said, well, what would it be like if we put a plan together so that stopped, so that when we did dentistry, that it had a chance to last the rest of your life without having to be redone? That's the thought process that I have. Any dentistry I do, there's no reason why I should fail in 5 years and insurance should pay more for a new crown or whatever. I just don't believe that. Now, having said that, you also have to understand that they have to follow the right rules. They have to come in every 3 months for their cleanings. We do laser pocket disinfection at every visit. We try to nuke the bacteria. We give them certain rinses and certain things that they can treat themselves as well. Medications, there are all types of saliva substitutes. There's things that they can do, but they have to be really careful when sugar comes around, and so wearing a night guard. That patient's biting and tearing stuff up, they've got to wear the night guard. So in our hygiene department, we literally have the risk factors set right there. They're a high functional risk, they're a high aesthetic risk, they're a high, whatever those risk factors are. And my hygienists at every visit go, how, your gums are looking good. You're here for your 3-month recare. We're going to use the laser. How's the occlusal guard doing? Well, and if they say, well, with their eyes squinty, that means they don't know where it is. And my hygienists are so well trained, they will tell the patient, now, are you been wearing it? Well, it just doesn't feel comfortable. I go, remember what Dr. B said? Your bite is extremely strong. You've got to wear that thing. I tell you what, bring it in. Dr. Baird will adjust it. Gay will do it. Summer, they will get it to where it feels totally comfortable, because you got to wear that thing. Otherwise, you're going to tear up the dentistry, and then, you'll have to redo it. And we don't want to do that. Does that make sense? And that gives patients, in my opinion, it gives patients a totally different thought process as far as, I'm going to the dentist. The dentist told me I needed this. They told me I needed that. They told me I needed this. No, they shared with me why the things that are going on in my mouth, why they're happening. And when patients understand that, then they say, this is the best exam I've ever had. Why? Because I understand what the hell's going on in my mouth now. Somebody finally took the time to do that. And they'll say that this is the best exam I've ever had. Why has no other dentist ever told me this? And I always say the same thing. Well, we're learning so many new things, and I always want to stay on the cutting edge, because I'm a patient too. I don't want to lose my teeth. I don't want to have problems either. And so I become, for those patients, a consultant, not somebody who's going to, they come in and go, you need this, you need this, you need this, with no explanation. Dentistry is done that way 99% of the time across the country. 99 out of 100 dentists do it that way. If you do it differently, guess what? You're going to have a phenomenal practice. You're going to have people telling other people about you and your office. So those are the things to me that are so super exciting, about being a dentist today. Yeah, you worry about the DSOs, you worry about this, you worry about that. Don't worry about all that shit. Take care of your patients at the highest level you can with an explanation about why things are happening. And if you do that, your career is going to be amazing. You'll also enjoy dentistry because you're not taking responsibility for other people's failures. You know why? Because it's not your fault. It's not your fault they're not brushing. It's not your fault that they're not coming in for their cleanings. It's not your fault that they don't wear an occlusal guard. It's not your fault, but it is your fault if you haven't told them all that. Does that make sense? I know you probably already knew this. Those are my two sayings that I say all day long. But anyway, I enjoyed today. I hope you guys get something out of this, and I look forward to the next one. Clinical Calibration Institute, that's the thing that we're doing now that can help get your whole team on that same page so that everybody is saying the same things. Everybody's excited by the chance of helping patients long term and not just drilling and filling and billing. So anyway, I'll talk to you guys at our next time. So look forward to it.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.